It says I'm live. My first Instagram live. Old boss, Dr. Oz, is going to drop in. Should be fun, guys. I'm here in Verdant Green, Michigan. I'm visiting my aunt and uncle. My sister is getting married today. And guess who's the minister? You're looking at him. So I'm going to be here until Monday, I think. It's beautiful. It's like 75 degrees right now. There's a light breeze. Hopefully you can see me. Hopefully you can hear me. Hey to everyone to hear. Wow. What's up, guys? Hey, Pat. Verdant, Rebecca says. Yes, very verdant. Dr. Nate. What's up, guys? I wish you guys could see what's behind me here. My uncle's creeping in. What's up, John? How's it going? Amy. Wow. This is fun. I should go live more often. It's like a party here. I've heard the, oh yes, and to minister. That's right, Sarah. Officially ordained. If anyone needs a wedding minister, let me know. Pink Tank with the brilliant commentary. Yes, don't we all? Don't we all? Thanks you guys for tuning in. I really appreciate it. Dr. Oz reached out a couple days ago and said, hey, you want to chat? I said, oh no, why would I ever want to do that? He's a nice guy. So we'll probably just chat for 10 minutes. I'm sure he has some interesting things to talk about, as he always does. We'll catch up. It's been a while. Oh, Amanda coming in with the testimonial. Yeah, she was the maid of honor at a wedding I did last year. That was a lot of fun. Much better weather today than it was then. It's been a crazy year, you guys. 2020. Thanks for joining me on your Saturday morning. All right. Oz is trying to get connected. Man, these comments are killing me. Sorry, I just laughed to myself over here. So let's see, tomorrow, 6:30. 6:30 is the pre-show. The real deal starts at 8. I've roped my family into watching this. We're going to get my favorite pizza here in Muskegon, which is Scribs. Don't tell Dr. Oz. And we're going to mow down, watch some TV, see what happens. It's been a crazy week. It's only going to get crazier. I already had my morning coffee, or else I'd pull some of that out. I hope you guys are having something similar. Over on the West Coast, let's see, it's only 8 a.m., right? Rebecca's up early. This is my second wedding I've done. I'm far from an expert, that's for sure. It's fun every time, though. You know, it's I feel like when you haven't done it very many times, you get to like really personalize it for the bride and groom. You know, you don't have like a template that you follow really, and you really get to tailor it to whatever they want. It's really fun. It's really intimate. Very small ceremony, obviously outdoors during times of COVID, and I'll be wearing a mask for sure. What am I wearing to the VMAs? Wow, very good question. Stay tuned, guys. All right, the man is here. Let's see if I can get him to join. Mehmet ready. That sounds good. Dr. Oz, how's it going?
Nate, congratulations. I'm so proud of you.
Thank you so much. It's good to see you. It's been a while. How are you?
Very, very well. I know folks probably know this, but when you were working on the show in the medical unit, which is the nuclear reactor of the show, you guys come up with all the great ideas that help us make sense of what's going on. You surprised us because you were a chef. And I thought, my goodness, how cool is it? The guy's both a doctor and a chef. I was jealous. I coveted your taste buds. And now I find out you don't just make great food. You can sing songs that are entertainers. It's fantastic. I'm so it's stunning.
Surprise. Thank you so much, Doc. Hey, everyone's got their hobbies, right? Got to do something in our downtime.
Well, that was more than a hobby. I mean, you're talented. And
thank you.
You had the right approach to the challenge of of medicine when you don't have all the answers, right? People, I don't know how you felt about this, but when I was studying in med school, I thought when I figure this out, I'll know everything, because
Sure.
my doctor when I was a kid knew everything. Then you finish med school and you don't know everything. You know a lot, but there's still lots of questions and still places you're powerless, like you articulated, especially early on in COVID.
100%. You know, I mean, like you said, you think you know everything once you get out of med school, but first of all, you don't. And then what do you do when a novel virus pops up, right? Something that no one in the world knows about. So I was looking to mentors and teachers and people in the hospital I'd always looked up to who had all the answers, and suddenly a lot of us didn't have any answers, and it was a really weird time. Still is.
So what prompted you to go ahead and belt out "Lean on Me"?
Yeah. Well, hey, like you said, I think, you know, back then we didn't really have a lot of answers, and there wasn't a lot of reassurance or hope I could give to my patients or to my, you know, friends and family and people I worked with. But, you know, something I could do was maybe make them smile, you know. So I that night had admitted my first COVID patient in the ICU, and it was kind of a weird time for all of us. The first one at our hospital, and the nurses, the respiratory therapists, the techs, and, you know, the docs, we all kind of gathered around in our N95s, and we said, wow, this is the first of who knows what is about to come, you know. And so I went home and was, you know, kind of delirious after a 14-hour shift. And the song was kind of on my mind. It's been a song I've liked ever since I was a kid, and we used to sing it at camp. And belted it out, recorded it, and wasn't happy with it at first. I was like, oh man, you know, it was a little pitchy. I messed up the piano in a couple spots, so I didn't post it. And then, you know, later when Bill Withers unfortunately passed away, I thought, you know, maybe this is a good time to share this with the world.
So, but it wasn't just good; it was great. The VMA is honoring you. I mean, it must be a pretty good feeling. Were you surprised when you heard?
Oh man, I thought it was spam. You know, I was out for a walk, my heart rate was up, I had my watch on, you know, my heart rate was like 150. I get up to my apartment, and then I opened this email, and then it shot up to 200, right? I was like, this can't be real. I immediately sat down so I didn't pass out, and kind of read through this email, and I was like, I can't believe this is. I mean, what do you have besides complete shock when an email like that lands in your inbox? I planned for a lot of things in my life, and this is not one of them.
So as you get ready to I know I remember a couple of years ago you joined me for the Emmy Awards, and I don't know if they're gonna feel the same. Do you anticipate a similar sense of some butterflies in your stomach, exhilaration?
Yeah, I mean, there's nothing like a show like that, you know, sitting in the audience, and then, you know, with someone you love and respect and look up to so much, to be nominated for such a fantastic award. And like you said, the energy and the butterflies in your stomach, it's just, it's not, there's nothing like it, you know. So the VMAs this year obviously going to be a lot different. I'll be watching them at home with my family. We won't be there on the red carpet. So the energy is going to be different, but I think that feeling in my stomach is going to be the exact same. There's nothing like it.
So here's the deal. We're getting ready to celebrate with you. So we got we just went fishing. We went shopping. So we got all this bread, right?
Oh, nice.
So I'm just curious what you think. I mean, can you see us making a great snack to celebrate as you win your award?
Oh man, that looks amazing. Every single type of bread. There's some mayo. All you need is some fresh tomatoes, right?
You mean like these?
Oh yeah. You know how it is, Dr. Oz. That looks amazing.
And these are the cherry tomatoes. Now, I got stung picking these cherry tomatoes. I don't know if you saw this, but
I did see that. Did you end up needing the EpiPen, or are you all good?
I didn't need the EpiPen. You know, we did a show this year, very selfishly in a way, because I kept thinking, am I still allergic? You know, I haven't been stung since I was a kid. And right. One of the immunologists has said, you should check yourself again, because most people, he said, outgrow their allergies. Which for a lot of people listening right now might be sort of interesting to know. So I got myself tested on the show, and I didn't have an allergy reaction to the little injection you put in your arm. So nice. I thought, you know, so anyway, it stung me right there in my ear. And I thought,
blow all up and get red.
Exactly. It's probably going to blow up and then necrose and fall off.
Yeah, right. Exactly. Yeah. Goodbye, ear.
And I won't be able to talk to Nate on Instagram Live. but I had no reaction at all, even though I had the pen.
Good.
I want to ask you though, because you were really a superstar on the show. What did you take away from your experience in the med unit? How have you been able to apply it, especially making television? Teaches you a lot about the emotion of a diagnosis. How has that affected your clinical practice?
Oh, does it ever? You know, I think the most important thing that I've learned, and that my patients, I feel like, appreciate every day, is like, hey, when I showed up to your show, I thought I was pretty good at breaking things down and explaining information to patients. But I quickly learned I wasn't. You know, I was speaking in jargon. I was using too technical of terms, and people weren't really understanding what I was saying, you know? Yep. And so I really learned how to break things down and explain those medical diagnoses to people in ways they can understand, and help them figure out what's going on inside their body too. You know, I think patients really appreciate that. But yeah, of course, I learned so much more. Like you said, the emotion of diagnoses and figuring out how to convey really the whole picture, not just the science, the biology of what's going on inside of your body, but how it affects you and your mental health and those around you. I mean, I think all of that is just so important. And then, something that I apply every day is, people ask me, you're really into food, you're a chef, but, what do you know about nutrition? I have no, I went to medical school, of course, but, notoriously, we don't learn a lot about nutrition in medical school. And I learned, I don't know, everything there is to know about nutrition. It seems like working on the Dr. Oz show, I had to read studies and studies every day. We stayed up to date and talked to experts. And that's been, just, I mean, so invaluable. The experience I had on season 9 of that show. I can't thank you enough.
So what can we do better? I mean, here we are. We're getting ready to launch a new season in a week. We're back in the studio, by the way, for the first time. So
nice.
Be careful about COVID as you are. In the hospital, we're used to it because we had to, keep keep taking care of people. So you know how to protect yourself. I don't know how you've done, but we haven't really had contamination between COVID-19 patients and people who aren't COVID-19. Has that been your experience, that the precautions work if you do them right?
That's 100%. I was really scared at the beginning of this. I have asthma myself, and I was taking care of patients in the COVID ICU. And, I was gowning up, wearing my N95 and my face mask. But, if it's only 95% effective, you think to yourself, there's still a pretty good chance I could end up with this, with this disease, and who knows what would come of it. But I obviously work with lots of doctors every day, and I haven't gotten it. And none of the doctors I know have gotten it, although obviously people have, at the health system. But I think the moral of the story is if you wash your hands, you don't touch your face, you wear a mask, and, in really high risk situations, you wear that face shield or the gown, gloves, you're good to go. I mean, that PPE really is doing its job. And so, like you said, what is there to learn? Follow the precautions, listen to the government, listen to the CDC, and stay safe,
So as we get ready to launch, what's a topic around COVID-19 that you think America's confused enough about or unsure enough about that we might want to cover it on the show? Give me some minutes. Folks who are listening, by the way, Nate and I are reading your little notes, so keep sending ideas, more ideas, better ideas.
Yes, please comment. Whatever you guys want to know more about, whatever is confusing you in the media or the news, or just let us know. Yeah, absolutely. Dr. Oz will tackle all those questions. I think people are really confused about if you get coronavirus the first time, how long are you safe for? Can you get it again, and when? And I think more and more cases. Just yesterday, we had our first confirmed or documented reinfection here in the United States of COVID, and people are concerned. It was only a couple of months or so in between infections. And so I think what we know right now is that this virus can change a little bit. And just because you've had it once doesn't mean you can't get it again. And so it's really important to continue that hand washing, social distancing, and wearing a mask.
What about the idea of having T killer cells, having immunologic protection from having a common cold last year? Is that why Nate did not get sick? Is that one of the reasons that some argue maybe a third of the population may already been exposed enough that they won't have a real reaction to COVID-19, if any?
Right. I think a lot of it depends from person to person, but like you're saying, Dr. Oz, a lot of people have been exposed to different coronaviruses before. The coronavirus causes a lot of what we call the common cold. So you and I, we may have been exposed to a coronavirus before, and our T cells and our immune system is kind of ready to go and attack this new coronavirus if it comes. And, not to say we won't still get sick, but maybe our immune system will do a better job of keeping all the symptoms, or at least some of the symptoms, at bay. And so I had the common cold in January that was found to be a coronavirus. So who knows? Maybe that conferred some kind of immunity. Maybe my immune system was kind of trained a little bit, and that's why I haven't gotten it. It's just so early in the pandemic. These are questions everyone has, and I don't think anyone really knows the answer yet.
Listen, I am proud of you. I just want to take a second to congratulate you. I hope some of the wonderful work you're doing rubs off on your colleagues and helps elevate all of our discussions, not just about COVID-19, but about caring for each other. You mentioned earlier that if we do the smart things, we can reduce the chance of having a problem. I think it's the kindness that we've seen expressed from individuals, the safety net of love that has kept America buoyant through this process is reflected in you singing "Lean on Me." So God bless you. I wish you the best. I'm praying for you. You got the entire show rowing the oar.
I appreciate it. Thanks so much for tuning in. Hey, and stay happy and healthy at home. In your words, right? We'll continue trying to stay away from the coronavirus. Thanks again for all the kind words, and we'll hope for the best tomorrow, huh?
God bless. We're praying for you.
God bless you. See you later, Dr. Oz.
Okay.
Bye. All right. Thanks so much, guys, for tuning in. Dr. Oz, great guy. As I mentioned, has been a really important mentor and boss and role model for me. He is just as nice in real life as he seems on the camera. And behind the scenes, there are no, meltdowns. He doesn't demand Fiji water in his dressing room. He's just a nice guy, incredibly intelligent, and very, very well qualified. And he really tries to do what is best for you and me and the rest of America. And so, thanks so much to him for joining us today, and thank you all for tuning in. And like I said, VMAs pre-show tomorrow at 6:30, 8 p.m. is the real show. We'll hope for the best, and stay safe, everyone.